Welcome to our fourth episode of Breaking the Bamboo Ceiling, a collection of Asian American Pacific Islander social work voices. Hi, I'm Chris Lum,
And I'm Francis Joseph Gallego.
and we are API social workers from the Bay Area. We're here to create a safe space to uplift Asian American Pacific Islander social work voices, stories, and experiences across diverse communities and spaces.
The bamboo ceiling refers to the invisible barriers that limit Asian and Pacific Islander social workers from advancing into leadership roles. Despite high qualifications, Asian Pacific Islanders hold only 6% of senior positions in sectors like the government and nonprofits, far below their workplace or workforce representation.
Today, we'll be interviewing Lance Toma, Commissioner on the California Commission on Asian Pacific Islander American Affairs and CEO of the San Francisco Community Health Center, one of the nation's leading organizations serving Asian American, NHPI, LGBTQ, HIV and AIDS, and communities of color. Lance has been with San Francisco Community Health Center since 1999 and has led the agency since 2006, bringing over 2 decades of visionary nonprofit leadership. His influence reaches far beyond San Francisco through key roles with the San Francisco HIV/AIDS Providers Network, the California LGBTQ Health and Human Services Network, and NMAC and Centrelink. Born and raised in Hawaii, Lance began his career in Chicago working with LGBTQ youth, adults, and elders, and went on to earn his master's degree from the University of Chicago. And welcome, Lance.
Hi,
Welcome,
good
Lance.
to see you. Thank you for having me.
It's such a privilege to have you. Thank you so much. So, Lance, I'm going to ask the first question. Um, can you share a bit about your personal journey and what are some experiences or people that influenced your path into social work and that inspired you to become an Asian Pacific Islander LGBTQI leader?
Um, well, first of all, just thank you for that introduction. That was super generous, and thank you. And thank you for having me join this conversation with the two of you. I love being in conversations with fellow social workers. It means a lot to me. Yeah, so I think when I was reflecting, I've always wanted to be a social worker. Growing up in Hawaii, it wasn't like being an API person. It wasn't like the thing to become a social worker, but I felt it like, and I even thought about it and I researched it, but that wasn't my initial path. I think I was pushed and into the engineering field, and that's what I studied in college. But when I was in college, I was a resident assistant, and during my training to become an RA, I met this pretty amazing, fabulous Korean American woman who was part of the training team for us, like fledgling RAs. And I was just enamored with her. She was a social worker. She was dynamic and incredible, and she has become one of my closest friends ever since. But she is somebody I would say really, really helped me to see a path for myself to become a social worker. And so I followed in her footsteps, went to the same social work school that she did, and yeah, and then have never looked behind. It's been my path ever since.
Thanks. Yeah, thanks, Lance, for sharing that. Um, is there anything particularly that that she had that she shared with you that I mean, it sounds, yeah, like social workers were not always, we don't always brag about jobs, our roles, right? What do you think from her that you know really attracted you about? I mean, you don't often see or hear, social workers' jobs, or you know, um, pe- you know, families often talk. lawyer, engineer, doctor, right? What
Yeah.
what is it that she had that big eye-opening impact on you?
Yeah, well, her name is Shinhee Han. She's in New York and doing fabulous work as a social worker there, and an incredible therapist and teacher and author, all of that. And so when I met her, she just was. She was somebody who was just fully herself. She brought all of herself, to her work, and she was passionate and funny and smart and incredible. So it was like, oh, I see a bit of myself in her, and I was like, wow. And she's this social worker. It's a profession that I've always been curious about, and so it was there, and I went through my college program, and I was able, and I did become an engineer and worked in the field for a couple years, but in order to then find my way to social work school, and Shinhee continued to be a very close friend and mentor and roommate. We became roommates after I left college, and it was exactly, I think, my path, and then going to social work school, it just felt like, oh, this was my passion. This is exactly what I wanted to do and learn and think about and contribute, to the world. And so that felt like things started to kind of fall into place, and I think I was in Chicago then, and he wasn't a social worker, but the other person that really kind of guided me towards my kind of API queer kind of leadership journey. I moved after working for many years in Chicago, I moved to San Francisco, to my organization now, which was then called Asian and Pacific Islander Wellness Center. Francis, you know it well. And my predecessor here, John Manzon Santos, wasn't a social worker, but social justice leader, warrior, and so gay API man who I was just really, really like in awe of. And so it was just a privilege and honor for me to then get to work here at my organization now, and with John for 6, 7 years. And then after he left, I became the executive director and CEO.
Thanks, Lance. Yeah, I can relate to bits and parts of your story. Yeah, I think social work really, right, really looks at just allowing the person to be the person who they are, and we're really grateful for these mentors or people that allow us to find that path. And it's not always the easy path. And the second question is, what barriers did you face in your career, in your social work career path, and how did you learn to navigate or challenge any of these barriers in your career path?
Well, I think the first kind of barrier or challenge was just family acceptance. As we're sharing, like doctor, lawyer, engineer, and I fell into that, with my parents, and so I think it was like just coming out to them. Before I came out as being gay, I felt like I had to come out to them as wanting to be a social worker. I think that was a big moment for me to really explain why and what that was and how that what that meant to me. I think it wasn't a super surprise. I think it's always has been like connecting with people and being of service, and volunteerism and helping community has always been my extracurricular, but that really was what I wanted for myself to be front and center, and I think they got it, and so that was I think the first for myself. I really wanted my family to really understand that, that path, and be supportive, of it for for me. And I guess the other, and so there's that. And then I just think what all the barriers, when I came to what was then Asian and Pacific Islander Wellness, API Wellness Center, what I knew and realized is that we had to fight for every single penny of funding, to resource and keep our doors open, and so we always had to advocate and make a case for why API queer people, were impacted by HIV, and that it wasn't just you could have, sort of these mainstream organizations and expect that that was going to serve our communities. Like, that was not going to happen. We were going to fall through the cracks, and so that's why the organization came into being. But I think even once it was came into fruition, it still took so much effort. It wasn't just about providing good services. Like, we knew how to do that, but it was having to fight, advocate, and storm stages at conferences and do all that to say, APIs deserve recognition, right? And I think I was just remembering, we have so many I have so many mentors and so many folks who have fought this fight even before me, right? And they fought to get data right. We were other. We were Native folks, API folks were always other in these data sets at CDC. And even when I started in this advocacy work, we started to see APIs, Native Americans, and then we still had to fight for continued data collection efforts, right? So that we could collect the data that was culturally competent, especially for the API community. There's so many categories and cultures and languages, ethnicities, races within our umbrella. And in order to really understand any of our health issues, we needed that data, and then that data to get disaggregated, And so I just feel like it continues. That's still my work, now, to ensure that, and even more so now, right, where they're trying to dismantle systems right now that are really trying to protect our health and take care of health for communities broadly, but particularly for the AA and HPI community. It's so critical.
I just wanted to say, thank you for talking about not just the power of representation, but the power of, speaking your voice. On the side note, to our listeners, I've known Lance since 1999, and I've been able to share space with him in terms of being present with him in a few conferences, and it does really speak to the importance of what the work he's done. I was still a youth back then, but the work that he's done in terms of just really fighting fighting for our voice, but also letting people understand the diversity within our community, and the different needs within our community, and that we're APIs, queer Native Hawaiians, we do exist, and that our needs are very different. So I just want to say thank you to you and the other people who have paved the way for us, and to say that we do exist and we do matter and we do deserve healthcare and all these different things. So thank you so much for all you've done. Thank you.
That means a lot, Francis. But yeah, I love that we continue to be in this work together,
Thank you.
Yeah.
And also you talk about breaking stereotypes, right, and breaking barriers, from challenging not being an engineer to be a social worker, right, and also challenging this model minority myth, right,
Mm-hmm.
Challenging the fact that we're all singular, right, we're all one myopic, and then we're bigger than this.
Mm-hmm.
What other barriers have you broken in terms of in your career, or anything that's been significant for you that's helped you kind of continue to hold this leadership role within our community?
Mm-hmm. Well, I do think let me think. I do think social work teaches us so much, right? I think it's such expansive field, and even in our educational curriculum, like it was such a eye-opening experience for me to realize, like, not, I wanted to be a clinical social worker, and I practiced clinical social work for many years, and I loved that. But I think I started to see that, there's impact that can be made, and I can contribute to that impact in different ways, that were on a much more macro level. And so I think that's where, when I was in Chicago, like, being this API queer person, I was like, it was like, wait, I don't know where to go with this, and that's where I found a home. I really had to relocate, to San Francisco to really, I think, learn and experience what it was to become more of a leader in a space, and understand, because I didn't really have, a lot of role models for that, and so I really feel like I feel so lucky to have been able to learn from, John, who I mentioned before, but so many, then I got to meet so many other API, queer, HIV community leaders, and it was magical to me. It was like, oh my gosh, this is the community I want to learn from, and let's break these, whatever it is, break the stereotypes, barriers, all of that's like holding not just us back, but I feel like the holding back what we could envision for our communities and what we deserve, and even going beyond what was like the meager scraps that we were getting. Like, it was like, no, that's not okay. But it took me being in community to really get it, and to be bold. And so, I have a lot of folks that, I'm just so grateful for, but, it really was like challenging me to be like bolder than I ever thought I could be.
Yeah, thanks, Lance. Really appreciate you just speaking so many rich, just the power of what the unique qualities of social work. I like, we there's a fight, right? There's a fight that social workers go into that is unique from different other career paths or for professions. The next question is, was there any clients or experiences in the community where you had just a powerful impact on creating, empowering a client, or empowering the community, or making some kind of change for a client or system in the community? Was there anything in your career path that you, yeah?
I mean, I feel really so lucky, to be at my organization. And it is all about social work values, I think. It's about the direct service that we provide to the most marginalized folks here in our San Francisco Tenderloin neighborhood. But it goes beyond that, right? It's building leadership, and it's building power within our client communities so that we can make change together, that we can change the conditions that have created homelessness or mental illness or HIV to be an issue in our community. So I think I feel like I get to see this, what a sense of belonging does for people, right? Like, it really is so impactful, and I see it almost every day. Like, I love coming to work every day because I get to bear witness to that. What's resonating for me as you spoke the question was really, right now I just think, and what all of my effort is going into is doing all that we can to fight for our trans communities. like, so that's what I would say, like, in this moment right now, what I witnessed, in the past year was that there was at a federal level a community of folks that I work with every day and we serve. It's one of our central kind of and communities. The trans community is that there was this erasure attempt to erase an entire community, an entire group of folks, and it was terrifying and disgusting, and and scary. And when I read through that specific, the executive order on gender identity, at first it was like terrifying, and then it was like, wait, what do we have to do? What have we learned? What have I learned? What have we done? And it was actually, we have to fight. We can't cower, and that's what, but it took a while. It took some time. I mean, I didn't have a lot of time but it took some time. But ultimately, it was like, actually, we have to stand in a place of like, this is not okay, and we're going to do everything we can to protect and support and be in solidarity with our trans community members. I'll share, and our funding was targeted. And, we do so much. We have a drop-in center for our trans community. We have a shelter that we run. We have programs and services. And so, a third or maybe more of our staff are trans identified. And so, that's over 50 staff members of ours that are trans and gender nonconforming. And so it was huge for us that we were going to take on this fight. And we actually are in a lawsuit, against the Trump administration because we couldn't stand by and see not just ours, but many of the other organizations and the potential dismantling of not just services and incredible work that's been doing, but actually like erasing an identity, of our community. So I feel like that's been my work. That is what I am here to do right now, and I'm. I don't know. I know I'm going off in different tangents, maybe from what you asked, but that is what I feel like is, and I see the breakthrough. I see that this work that we're doing is enabling our trans team members to come to work every day and to fight the fight and to know that they're going to be protected in as much as I can protect. As an organization, we can protect folks. It's not everything, but at least, we're going to do everything we can to ensure that we're doing right by our trans communities.
You bring up another thing that's so important is that, the scapegoating that happens in the United States between, very vulnerable populations, against the trans community and
Yeah.
communities of color. And, the importance of what we can do to provide support, and be in solidarity and also speak up, especially in a time now where, people look down on like empathy or people don't understand different things, and what we can do as not just social workers but leaders or community members to really protect other people who are vulnerable.
Yeah.
I think you talked about this too earlier about how we're in a different political time right now, in which a lot of voices are being silenced that do not benefit from privilege, and that is extremely problematic. And we talk about also the power of intersectionality, the power of like how we're all connected to each other in different ways. I just want to say I really appreciate that, because I think sometimes it can be a little bit, people may not understand like how we're all connected in a lot of different ways, or also like when I first started work, when I was in AP, I wanted to remember your organization before I transitioned to name, like the safety it gave for, I started there when I was 17, and the safety it gave for not just queer folk like myself, but other trans folk, but also allowing us to see how other people lived and to understand it, and for people to not be erased,
Mm.
and for people to speak their voice. Because growing up, I never saw someone that looked like me. I think you were the first. Like, I remember, because like I'm part Japanese and you're Japanese. I was like, oh my god, huh? I think that ability to, like, you were the first, like, pure Japanese person, like, other than, well, I'm part, but you know what I mean. Like, I remember we had that conversation when I first met you,
Yeah.
and I remember how empowering that was, because then we don't seem so alone. Then we don't seem like we're a mistake, or we're other, like you said, and
Yeah.
we seem like we could find this sense of, like like companionship and someone to stick up for us. So thank you again for reminding us of that. And my question, I'm sorry, I just wanted to talk about what other challenges or systemic, like, inequalities do you think are impacting API quality clients? I know you've talked a lot about the trans community and how it's very challenging,
Yeah.
but
Yeah.
what other things do you think are happening, and what can we do to change that?
For our API community,
Yeah.
just
Hmm.
yeah. Yeah, and I have the privilege of, you mentioned in my intro, Chris, being on the commission. I serve on the California Commission for Asian Pacific Islander American Affairs. It's such an honor, to do that, and I was so excited to serve, because the issues for our communities, we still have so much work to do, and the issues around what we were saying, like data, we still haven't gotten it to where we need it to be in the state of California. Like, where we think, we should be the leaders around this. And it's like we still have so much work to do around data disaggregation. And then even when we look across the state, language access for our communities, we have so many different languages, and they're not getting prioritized. Folks still are going without, like, having to confront all these different forms or resources or benefits that you can't access if you're not able to understand the processes, or you don't have the interpretation and translation, or the forms and ability to get what you deserve, and then, I think the other pillar for us is around mental health. I think especially even for, like, queer, trans, API communities, but broadly, the mental health is the other area for us in terms of health that's so stigmatized in our AA and HPI communities, right? And through COVID, through all of the immigration challenges and attacks, it's hitting our communities so directly. And of course, we got to deal with that, just the structures and the issues, the systems that are targeting us. But then it has all this impact on our mental wellness, and so we got to figure that out too. And I that is also part of what I want to contribute to, and I feel like that's what I get to do through my work there. And there's a great, and Asian Health Services, and there's so many amazing groups and I'm part of, the steering committee for the California AA and HPI Health Equity Coalition, and we're really trying to make sure that we're listening and understanding, hearing, elevating the needs and issues, like, throughout California, especially those pockets where we have so many folks, our API community, especially in the Central Valley, or even, like, southern, in Imperial Valley, and we're really trying to get to these networks that need more. And we need to be really hearing, listening, and acting, on behalf of the smaller pockets of our communities. And for the past few years, on the commission, like, the PI community has been, for me, a priority that we make sure that we're really paying close attention to, because I think, and this is what I've learned here at API Wellness and San Francisco Community Health Center. You can say you're API, but, like, PIs always kind of get the short shrift, right? Like, it's like, unless we really focus and pay attention and get to our leaders there and work with them, it's that the Pacific Islander community needs so much more focus and support.
Yeah. Thanks, Lance. Once again, you're just sharing so much about the power of social work degree and how much the impact or the tools that you're just fighting for to give the voice of those who don't have that voice. Um, the next question is about uh, collaboration, coalitions, and networks. Can you describe or talk about, well, what role does has collaborating with other coalitions and networks helped you in advancing API LGBTQ health equity issues?
Uh, yeah, I would say, I mean, collaboration, coalitions, like that's where it's at. We can do. It's just like, yeah, it's not about the individual. It's about the collective. It's about community building, and I. So yeah, of course, the commission that I serve on speaks to that. But I would say, I'm so. I also worked a lot with the founders of the National Queer API Alliance in CAPIA. We were their fiscal sponsor for many years here, and so I got to really, work with their founders and be in community with them and to see, and that's what we need, and I love that NCAPIA, is continues to be a strong institution for us. It really is the group of that is advocating for the queer API community across the country. So I would say, coalitions, it's everything. I think as an organization, I was speaking, earlier about how we had to fight for every kind of resource that we needed, but because I was in network with other API HIV leaders across the country and Hawaii, we were able to really challenge each other to work together and demand more, and create a platform. And that's what it takes. I feel like we can't fight alone. We got to fight in coalition. And that's what gets us stronger. I remember once when at the U.S. Conference on AIDS, where the Native community and the API community, we stormed the stage and we stopped the opening plenary from happening. And the Secretary of Health and Human Services were like, "No, you're going to listen to us before you speak to this group because you need to pay attention." And it was because we were in solidarity with the Native American community, because we were facing so many similar issues around data, around the numbers, always saying the numbers are too low for HIV, and we're like, you're not even testing us, our communities. You got to first, get these resources out, so that we can know what the impacts are, and no matter what the numbers are, you still have to prioritize. Prevention, care, testing, all of that, right? And that's not just for HIV, it's like what we need across so many of the health issues that are disproportionately impacting, our communities. And social work values, I would say, yeah, I love that. Like, I love that you're talking, Francis, you were talking about, like empathy. Like, empathy is like, it's human relationships, right? It's about how we all need to be in community with each other. I often talk about at San Francisco Community Health Center, it's like, how do we create a culture of joy and belonging and love and empathy and compassion? Like, that is, if we can do that for our team members here at our health center, we're doing that for our community, our clients and our communities that we're serving. And I just think that's where we create power. If we get healthier, stronger, we build power, and then we get to justice. That's what we're trying to achieve.
The word joy, I think joy is such an emotion that talks about self-resistance, right? Like, you're resisting things that are meant to put us down, and I'm glad that you are able to share that word with the people you work with and the people in your organization, because I think a lot of times when we live in times that can be very challenging, we can be stuck in a certain emotion, but being able to feel the dialectic, right? Feel the struggle, but also know that we are empowered and that we can work together.
Yeah.
And I actually remember, just on a side note, like being in the U.S. Conference on AIDS, not the one you were talking about, but being in a working group with other, Native, Indigenous Hawaiian, also as Native Indigenous Eskimo, and
Hmm.
being part of that working group and feeling so empowered and seeing that, our voices were actually being heard and being elevated. And you were part of that too. And I remember just how empowering that was too, because there's a lot of whitewashing, I think, within not just
Yeah.
the LGBTQI community, but also within the HIV community, in terms of like whitewashing and that things don't exist, and very like, and it's silencing. And I think being able to see our faces and see our voices and see our diversity
Yeah.
just made us feel we belonged, you know.
Yeah.
And so thank you for being an integral part of that. And my question is that, you know, um, social workers will be listening to this. Other Asian Pacific Islander social workers, and you mentioned your mentor who mentored you. If you had advice to, like, let's say someone who was listening who was still in social work school, what advice would you give them in terms of them going into this career?
Mm. Well, first I would be like, right on, that you're in social work school. I love that, Francis. I feel like I promote it all the time. Like, social work is like such an amazing path. I was even just speaking to one of my on the ground counselors, and now he's a program manager here at my health center, and he's curious about social work and public health. And I love that. We need more API social workers, API LGBT social workers. So okay, so if they're already in social work school, like find all of us. Like see, like I think what I've learned is like we all wanna support each other to thrive, and to find where we all belong. Because that's what I love. Social work isn't just one kind of job. There's so many different places for us, and if we can be in all these places, that's what I've learned, right? You create the relationships, and you may not need them tomorrow. I mean, need them to, in community, but in 5 or 10 years, we're going to need that person that I met, because now they're in this other place, and we can work together because now they're funding, or they're in government, or they're in this institution, or we can collaborate. Like, I just feel like the network that I've seen blossom over time and I'm older, right? Like, I've been doing this for a few decades now. So I would be like, you're going to be entering into this really beautiful, empathetic and joyful community, and we really want to nurture that, right? And I don't know, yeah, whatever I could do to be a part of that, and yeah.
Beautiful.
Yeah.
I would also say, like what I've learned too is like social work school, and then what you do afterwards, just continue to, like I'm saying, like build your network, like friends, colleagues. Like, this is hard. This is hard work. Whether you're doing direct service, whether you're advocating, whether you're doing policy, whatever you're doing, like when you're fighting an uphill battle, it's tough, and it takes, and especially when you're doing it on behalf of your communities, that's even harder, right? Like, you're actually like it impacts us in different ways when you're fighting for yourself and your communities, right? It has a different weight, and it's a lot, and so to make sure that you're putting in the time and effort to build your group of support and your support system, I just feel like that has sustained me over time too, and that has been so vital to my sustenance, as a social worker, but as a executive director and nonprofit, leader.
Thanks, Lance. I'm really grateful for you sharing your passion. Um, we like you said, we need to share, you know, um, to inspire and allow other future API social workers, and by you sharing your experience, it will have so much help to empower someone out there on this path. So I really, really appreciate you taking the time and just sharing everything. It was really, really great. Um, and before we end, is there anything you can share, how you find joy in these challenging times?
Well, I will say, just like being in conversation with you both has been joyful. I just feel like that. So thank you for everything you're doing to uplift this incredibly important profession, and the work that we're all doing. So thank you. I mean, that this is part of that. Um, and then, I mean, these are some of the hardest times, I feel like, like this has been like crazy. Um, so I think it's like, how do we, like what we were talking about, how do we find joy, like just even personally, right? How do we make sure that we're, um, in whatever moments you can do that? And joy and hope, I would say, like we cannot lose sight of hope and joy, because I feel like there's so many forces right now that are trying to take that away from us, from our immigrant communities, our API communities, our trans, queer, communities. It's just it's cruel. So it's on us to do that. And I'll say I have an amazing family, right? I have a husband that cares deeply about me. I have a son that we've raised. He's an adult now, but Eric, my husband, almost at times has to force me, like, we're going to just do something for an hour or a few hours that's nothing to do with this, and I feel grateful. I live in San Francisco, and the Bay Area is pretty phenomenal, as and so we take advantage of that. And even if it's just like going for a walk, going for a hike in the park, or near us, that, or going for a run, or that I do, that taking care of ourselves, we got to do that, because yeah, and I share that with a lot of folks. We got to take care of ourselves, find joy and hope, so that we can continue to fight the fight that's right at our doorstep, and it's going to be with us for a bit to come.
Thank you also for talking about the importance of self-care and rest. That's synonymous, with what we do, because we have to sustain ourselves these times. And I also want to thank you as well, but also the listeners of Without Blue Feeling, for just allowing us to have a collection of Asian American and Pacific social voices that's presented by the National Social Work Agents of Groundbreak Social Work Council. Thank you so much. Thank you, Lance.
Thank you both very much.